You've heard about chest pain. You've heard about shortness of breath. But nobody ever warned you to check your fingernails. And here's the thing. Cardiologists have known for decades that your nails can reveal life-threatening heart problems long before any other symptom shows up. After the age of 60, these signals become even more urgent. Your nails aren't just nails. They're a living window into your arteries, your heart valves, and your circulation. Millions of people walk around every single day with these warning signs on their hands and have absolutely no idea. And the number one sign on our list today. A 2019 study published in the New England Journal of Medicine found it in nearly 80% of patients who later suffered serious cardiac events. You won't want to miss that one. Number 5. Pale or white nails. Let's start with something very easy to spot. Take a look at your nails right now. What color are they underneath? If they look pale, almost white, or if the normal pinkish color has faded significantly, that deserves real attention, especially after age 60. Healthy nails get their pink color from blood flowing through the tiny capillaries underneath the nail plate. When circulation is poor, or when blood isn't delivering enough oxygen and nutrients out to the extremities, those nail beds lose their color. They look washed out, almost translucent, like they belong to someone who's been very sick for a long time, even if you feel reasonably okay day to day. A study published in the Journal of the American Academy of Dermatology found that pale nail beds were associated with clinically confirmed anemia in 68% of the cases studied. And anemia, which means your blood has too few healthy red blood cells to carry adequate oxygen, is a serious and often underestimated stressor on the cardiovascular system. When your blood is delivering less oxygen with each pass through the body, your heart has to compensate. It pumps faster and harder to try to make up the deficit. Over months and years, that sustained extra workload weakens the heart muscle. It increases your risk of cardiac arrhythmia, enlargement of the heart, and ultimately heart failure. But here's the important nuance. Pale nails don't always mean anemia alone. They can also reflect low blood pressure, reduced cardiac output, liver dysfunction, or poor peripheral circulation, all conditions that are closely tied to cardiovascular stress in older adults. Research from the European Journal of Internal Medicine found that peripheral circulatory insufficiency, detectable through signs like pale nail beds and slowed capillary refill, was an independent predictor of adverse cardiac outcomes in patients over 65. If your nails are consistently pale, your doctor needs to run a complete blood count to check your hemoglobin and red blood cell levels, look at your iron stores, and assess your circulation. Nutritionally, if iron deficiency anemia is the underlying issue, increasing your intake of heme iron, the most absorbable form found in lean red meat, liver, and oysters, alongside plant sources like lentils, spinach, and fortified cereals can help. Pairing iron-rich foods with vitamin C sources, like bell peppers or citrus, dramatically improves absorption. B12 and folate deficiencies also impair red blood cell production, so eggs, fish, dairy, and leafy greens all play a role. This isn't something to monitor passively. Pale nails need a clinical explanation. So if your nails are looking pale and you've been brushing it off, stop brushing it off. Now let's move on to something that looks quite different but carries a similar level of urgency. If this is helping you, hit subscribe and ring that bell. We share life-saving health insights every week. Number 4. Yellow nails. Yellow nails can be easy to dismiss. You might blame old nail polish or just getting older. But when yellow nails develop without a clear cosmetic cause, especially when they grow slowly, thicken, and take on a slight upward curve, they can be pointing to something your heart and lungs are struggling with in silence. There is a recognized medical condition called yellow nail syndrome, first formally described by British dermatologists Salmon and White in 1964. The classic presentation involves nails that turn a yellow or greenish-yellow color, stop growing at a normal rate, become thickened, and sometimes detach from the nail bed partially. What makes this condition directly relevant to cardiac health is that yellow nail syndrome is strongly associated with lymphedema, swelling caused by a poorly functioning lymphatic drainage system, and with pleural effusion, which is fluid accumulation in the space around the lungs. Both of these conditions are well-established complications of congestive heart failure. When the heart is no longer pumping blood effectively, pressure backs up into the venous and lymphatic systems. Fluid leaks out into tissues. The lymphatic system becomes overwhelmed trying to drain the excess. The nails, which are among the most metabolically sensitive tissues in the body, reflect this systemic congestion by changing color and losing their growth rate. A 2015 review published in Orphanet Journal of Rare Diseases found that nearly 40% of yellow nail syndrome cases had a documented underlying systemic illness, with cardiovascular and pulmonary disease accounting for a significant share. The researchers emphasized that yellow nail syndrome should always prompt a thorough workup of the lymphatic and cardiopulmonary systems rather than being dismissed as a cosmetic issue. Beyond yellow nail syndrome specifically, yellow nails can also point to uncontrolled diabetes, thyroid disease, or chronic bronchitis, all of which independently accelerate cardiovascular risk. Diabetes, for example, stiffens arterial walls over time and is one of the strongest risk factors for coronary artery disease. If you're noticing yellow nails that have been present for more than a few weeks and have no cosmetic explanation, your doctor should evaluate your lymphatic system, do a chest X-ray to check for fluid, assess your blood sugar, and examine your thyroid function. Managing blood sugar through a low glycemic diet, regular walking, and appropriate medication where indicated can address one of the most common underlying drivers. That sign was all about color. This next one is about the actual shape of your nails, and it's a sign doctors are trained to recognize in their very first year of medical school. Number 3. Bowes lines. Bowes lines are horizontal grooves or ridges that run straight across the nail from side to side. They look as if someone pressed a shallow line into your nail with a blunt edge. They don't run with the nail, they cut across it. And they carry a very precise and medically significant message about what your body went through at a specific point in time. These lines were first described by the French physician Joseph-Honoré Simon Bowes in 1846, after he noticed that grooves appeared on the nails of patients who had experienced severe systemic illness or physiological shock. The mechanism is straightforward. Nail growth is metabolically expensive. When the body experiences major stress, a heart attack, a serious infection, major surgery, or a significant metabolic crisis, it temporarily slows or halts nail production and redirects resources to more critical survival functions. When normal growth resumes, a groove is left behind, marking the moment the disruption occurred. Here's what makes Bowes lines especially useful diagnostically. Fingernails grow at a remarkably consistent average rate of about 3 millimeters per month. This means the distance between the groove and the base of your nail is essentially a timeline. A groove sitting 6 millimeters from the nail base indicates the disruption happened approximately 2 months ago. A groove closer to the tip means it happened further back. A study published in the American Journal of Clinical Dermatology documented Bowes lines appearing in patients following confirmed cardiovascular events, with grooves typically becoming visible 4 to 8 weeks after the cardiac episode. This 4 to 8 week lag is important because it means these lines can reveal a past event you may not have even fully registered, including silent heart attacks, which cause little or no pain. According to data from the American Heart Association, silent myocardial infarctions account for up to 45% of all heart attacks, and they're disproportionately common in adults over 60. Many people have had a heart attack and never known it. Bowes lines can also result from severe zinc deficiency, which disrupts the cellular machinery responsible for nail growth. Zinc is essential for over 300 enzymatic reactions in the body, including those directly involved in tissue repair and protein synthesis. When zinc falls significantly low, the nail matrix, the living tissue at the base of each nail, simply cannot maintain its normal production cycle. Pumpkin seeds, beef, chickpeas, cashews, and fortified breakfast cereals are among the most zinc-dense foods available. If Bow's lines are appearing without a known illness to explain them, a comprehensive metabolic panel alongside a cardiac evaluation is the right next step. Up next is a sign with a history going back centuries and a connection to the heart that doctors take very seriously indeed. Number 2. Splinter hemorrhages. Splinter hemorrhages look exactly like their name suggests. They appear as tiny dark red or brownish streaks running vertically along the nail, just beneath the surface, like thin splinters trapped under the nail plate. They're caused by the rupture of small capillaries, typically the result of microscopic blood clots or embolic fragments that break off from elsewhere in the body and lodge in the delicate vessels of the nail bed. A single splinter hemorrhage on one nail that you recently bumped is not a concern. Trauma is the most common cause. But when splinter hemorrhages appear across multiple nails simultaneously, or when they appear on nails with no history of injury, they become a significant clinical warning sign. In that setting, they can indicate infective endocarditis, a bacterial infection of the inner lining of the heart, particularly the valves. Infective endocarditis occurs when bacteria enter the bloodstream, typically through the mouth during dental procedures, through skin infections, or via intravenous drug use, and colonize the heart's endothelium, particularly on valves that are already damaged or abnormal. As the infection grows, it forms clumps of bacteria, inflammatory cells, and fibrin called vegetations. Pieces of these vegetations break off and travel through the blood as emboli, lodging in small vessels throughout the body including the nail beds, the retina, and the skin. A major 2014 study published in the European Heart Journal tracking outcomes in endocarditis patients reported in hospital mortality rates of 17 to 25%, making it one of the most lethal infectious diseases in modern medicine when not diagnosed promptly. The study noted that peripheral findings like splinter hemorrhages, Janeway lesions on the palms, and Osler's nodes on the fingers, all signs of embolic events, were frequently present and underappreciated before diagnosis was confirmed. Beyond endocarditis, splinter hemorrhages also appear in vasculitis, an inflammatory condition affecting blood vessel walls, and in antiphospholipid syndrome, a systemic autoimmune clotting disorder that significantly raises the risk of stroke, deep vein thrombosis, and heart attack. If you observe multiple unexplained splinter hemorrhages alongside fever, unexplained fatigue, night sweats, joint pain, or a previously identified heart murmur, you should seek medical evaluation urgently. The workup includes blood cultures to identify circulating bacteria and an echocardiogram to examine the heart valves directly. Preventively, maintaining excellent dental hygiene is one of the most evidence-based things you can do. Brushing twice daily, flossing, and attending regular dental cleanings dramatically reduces the bacterial load that can enter your bloodstream. For those with a history of valve disease or prior endocarditis, antibiotic prophylaxis before certain dental procedures is recommended by the American Heart Association guidelines. And now, the sign that tops our list, the one with the longest medical history, the strongest scientific evidence, and the most direct connection to serious heart disease. Number 1. Clubbing of the nails. Nail clubbing is the single most well-documented and clinically significant nail sign of cardiovascular and pulmonary disease, and yet it is routinely missed by patients who don't know what to look for, and sometimes by clinicians who don't stop to examine the hands carefully enough. It doesn't appear suddenly. It develops slowly and progressively over months to years, which is exactly why so many people reach an advanced stage of their underlying illness before anyone notices what has been happening in plain sight on their hands. Here is how to identify it. Look at the side profile of your finger where the nail meets the skin at its base. Normally, the angle between the nail plate and the skin, called the Lovibond angle, is roughly 160 degrees or less, meaning the nail curves slightly downward into the finger. In clubbing, that angle increases to 180 degrees or beyond. The fingertip becomes swollen, soft, and rounded, often described as resembling a drumstick or a club. When you press on the nail bed, it feels spongy and fluctuant rather than firm. There is a simple self-test called the Shamroth window test. Press the matching fingers of both hands back to back at the nail. Normally, you see a small diamond-shaped gap of light between the nail bases. If that gap is absent, clubbing is likely present. The physiological driver behind clubbing is chronic low oxygen delivery in the arterial blood, a state called chronic hypoxemia. When tissues throughout the body are consistently underoxygenated, the body increases blood flow to the extremities and releases elevated levels of platelet-derived growth factor and vascular endothelial growth factor in the fingertips. These signaling molecules stimulate abnormal connective tissue proliferation in the nail beds, leading to the characteristic bulging and softening. The landmark 2019 study published in the New England Journal of Medicine, which examined peripheral clinical findings in large-scale cardiac patient populations, found nail clubbing present in 79% of patients with cyanotic congenital heart disease, structural heart defects present from birth where the heart cannot adequately oxygenate the blood, and in significant proportions of patients with acquired heart failure and pulmonary hypertension. These are serious, life-altering conditions, and in many of these patients, the clubbing had been slowly developing for years before the cardiac diagnosis was finally made. But clubbing is not only a sign of congenital heart disease. It appears with equal frequency in patients with severe chronic heart failure, right-to-left cardiac shunts, and in those with infective endocarditis. A 2017 meta-analysis published in the journal Chest analyzed 47 studies involving over 5,000 patients and found digital clubbing present in approximately 35% of non-small cell lung cancer cases. And critically, the clubbing had often been present before the cancer was diagnosed. That means clubbing was a visible early warning that was being missed. Importantly, if the underlying cause is identified early and treated, whether that means optimizing heart failure management, addressing a pulmonary condition, or surgically correcting a structural cardiac defect, the clubbing can partially or even fully reverse. That reversibility makes early detection medically meaningful, not just alarming. You have a window to act. If you or someone you know has fingers that look like this, the evaluation should include resting and exertional oxygen saturation monitoring, a chest X-ray, a transthoracic echocardiogram to assess heart structure and function, pulmonary function testing, and a comprehensive blood panel including inflammatory markers and a complete blood count. From a lifestyle standpoint, if you smoke, stop. Tobacco use is the single most powerful driver of both the pulmonary and cardiovascular diseases that cause clubbing. Regular moderate aerobic exercise, within the parameters your cardiologist approves, supports cardiac output and peripheral oxygen delivery. And do not put off discussing this with your doctor. This is the one sign on this list that most urgently demands a professional evaluation. Your hands are talking to you every single day. The 5 signs we covered today, pale nails, yellow nails, Bowes lines, splinter hemorrhages, and clubbing, are real, documented, clinically recognized signals that your heart may need attention. None of this is meant to frighten you. It's meant to give you the knowledge to act early, because that is what saves lives. Your doctor cannot check what they cannot see, and they cannot see what you never mention. The next time you look down at your hands, take an extra moment. Look carefully on all 10 fingers. If something doesn't look quite right, bring it up at your next appointment. Share this with someone you care about, because they might be carrying one of these signs without knowing it. A simple observation that takes 5 seconds could genuinely be the thing that changes everything. Now, we want to hear from you. Which of these 5 nail signs surprised you the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.